All right. I see 64 folks in the room. I think they're still trickling in, but we are on the hour. So hello, everyone. Good morning, good afternoon, whatever time zone you are joining from. We're happy that you're here today for our HepNET Town Hall. This is actually our official debut of the Hepatitis Network for Education and Testing. Next slide. So we're going to get started today with an overview of the agenda. But first, while you're settling in, I do just want to pause and have everybody ask yourself why you're here today. So, we have 1 hour out of our day. You're joining the HepNET Town Hall, but there must be something that sparked your interest. So, was it the original email invitation? You heard about HepNET, how you can become involved. Maybe it was word of mouth from a friend or a colleague. So I just, want us to reflect on why we're here, and hopefully you'll get all of your questions answered today. If not, we'll definitely have the opportunity to have open discussion and see what you all can get from HepNET. So all that is to say, we're here for a reason. During the planning process of this event, we very strategically called it a town hall because we want it to be interactive, engaging. We want folks on the call, of course, to learn what HepNET is, learn how to become a member, and ultimately provide feedback about how we, as a partnership team, can tailor trainings, technical assistance, and resource development to benefit you and the communities that you're working with. So we're going to go through some introductions. We'll have some polling questions throughout the call, and then we'll jump into group discussions, which will be in separate breakout rooms. For folks on the call who are like, oof, breakout rooms, not my jam. That's okay, because if you decide to be fully participatory, great. If you decide to sit back and soak it all up, it's all good. So come as you are. We are going to see how, we can come together in these breakout rooms and have the greatest impact for collaboration. So next slide. A bit of housekeeping to get us started. This is a town hall where we are attempting to foster that sense of community. So we encourage the use of webcams. It's totally up to you, but we would love to see some shining faces. Everybody is muted right now. So if you have some questions or comments, you can use the chat box. This is being recorded, so the recording and the slides will be archived and then circulated next week. And we will finish off today with a short evaluation. Next slide. So we are going to dive into introductions. I already see folks in the chat box. Thank you. If you can, tell us who you are in the chat box. You can share your name, if you're affiliated with an organization, and then where you're joining from. So I'll get us started off. I'm Jasmine West, she, her pronouns. I'm a manager on NASTAD's hepatitis team, and I'm joining from DC. We will go through the organizational introductions, but first we're going to launch a poll to get your input. Again, this is a town hall, so we're hoping to solicit feedback from this event. So we're going to start with this first question. This is poll number 1. Can everybody see the poll? Okay, what is the ideal time for a webinar or virtual event? We have 30 minutes, 60 minutes, the hour, or 90 minutes, an hour and a half. So if you have other thoughts, you're like, actually 2 hours, that would be ideal. Or you aren't able to access the poll, you can still chime in the chat box. But let's give it a few more seconds for everybody to vote. What is the ideal time for a webinar or virtual event? All right. I also, for some reason, can't see the poll. So Isabel, does it look like results are coming through?
So far, 74% have participated.
Excellent. Then maybe let's close it out and keep going. Can we take a look at those results?
Absolutely. Are you seeing them?
I am not.
I love how we plan for this too. 81% voted for 60 minutes, 1 hour, followed by 16%, 30 minutes, and 3%, 90 minutes.
Okay. Well, lucky to those 84% for 60 minutes today. This is definitely something that we'll keep in mind moving forward. Thanks for your feedback. So before turning it over to our partnership team introductions, I want to provide some context when I say HepNET partnership team. This is comprised of NASTAD, NVHR, and NACCHO. Each of our organizations has an existing network, existing coalitions, and they do expand beyond the viral hepatitis community. So you'll hear from each of us. And first, I'm going to turn it over to Boatima so you can hear more about NASTAD.
All right. Hi, everyone. Appreciate the energy in this meeting as well as in the chat. Thank you so much, Jasmine, for kicking us off so beautifully. We really do appreciate the 147 participants, obviously understanding that's including the partnership team that we have on the line so far, and keep spreading the word. This is a coalition that is supposed to be vast and broad, and so we want to make sure that everyone's engaged. But anyway, as Jasmine said, my name is Boatima Ntiri-Reed. I'm the Senior Director for Syndemic Approaches at NASTAD and a proud member of the HepNET team and serve as the PI. And I am really excited that we have both colleagues who we've worked very closely with, but I'm also seeing a lot of really new names, at least new to me. And so I'm excited that I hope that that means that a lot of you are learning about us for the first time today. So for those of you who know NASTAD, you can just ignore me for the next 30 seconds. And those of you who are newer to NASTAD and some of the other partnership team members, listen closely because we're looking forward to partnering with you. So NASTAD is a Washington, D.C. based nonprofit. We provide technical assistance and capacity building to viral hepatitis, HIV, and harm reduction programs at health departments, community-based organizations, and in partnership with a number of critical stakeholders, many of you who are on the line, the members of our partnership team, as well as providing advocacy mobilization for state, local, and territorial health departments. And we're looking forward to integrating some of that policy work into the work we'll be doing with you all. Our mission at NASTAD is to advance the health and dignity of people who are living with and impacted by HIV/AIDS, viral hepatitis, and intersecting epidemics by strengthening governmental public health and leveraging community partnerships. And our vision is a world committed to ending HIV/AIDS, viral hepatitis, and intersecting epidemics. Before I wrap up and hand things off to National Viral Hepatitis, I must introduce my wonderful team members of the hepatitis team at NASTAD. So my fellow team members include, as they are pictured on this slide, Rita Isabel Lechuga, who goes by Isabel and is our senior manager, and as you may see helping out today, Jasmine West, who is our manager hepatitis and one of the project leads for HepNET, and Zakia Grubbs, who is a manager on the hepatitis team and one of our newest team members. So thank you for the opportunity to introduce you to NASTAD and look forward to working with each of you, and I'll hand it off to my colleagues at NVHR.
Thanks, Boatima. Hi, everyone. My name is Cass Botts. I am the Coalition and Capacity Building Manager for the National Viral Hepatitis Roundtable, or NVHR. So NVHR is a coalition of patients, healthcare providers, community-based organizations, and public health partners fighting for an equitable world free of viral hepatitis. So NVHR's vision is an equitable world free of viral hepatitis, and our mission is to eliminate viral hepatitis in the United States and improve the lives of those affected through advocacy, education, and support to national, state, and local partners. I feel a little silly. I didn't put everyone's names on my slide, but these are my team members. And from left to right, we've got, that's me, Cass Botts. Again, I'm the Coalition and Capacity Building Manager. Next is Dr. Adrienne Simmons. She's the Director of Programs. We've got Danielle Raymond, Director of Policy, and Robin Lord-Smith, who is our Community Engagement Coordinator. And I will pass it to our colleagues at NACCHO next.
I'm Kat Kelly. I'm a Senior Program Analyst on the HIV, STI, and Viral Hepatitis team at NACCHO, the National Association of County and City Health Officials. NACCHO is the National Membership Association for local health departments and serves as a leader, partner, catalyst, and voice for the nation's nearly 3,000 local health departments. Our mission is to improve the health of communities by strengthening and advocating for local health departments. And so this involves providing technical and capacity building assistance and support to local health departments in their efforts to develop, implement, and promote public health policies and practices. As the Senior Program Analyst on our HIV, STI, and Viral Hepatitis team, I lead our hepatitis portfolio, as well as some projects focused on harm reduction and at the intersections of the broader syndemic of HIV, STIs, hepatitis, and substance use. I use she, her pronouns, and I think I've covered everything on, about me and NACCHO. And I'm also joined today by my colleague Anjana Rao, a program analyst supporting our harm reduction and hepatitis work, who will be also closely involved in HepNET.
Great, thanks for that, Kat. So now that we have an idea of who the HepNET partnership team is, I hope it's all coming together. You know, our team is uniquely positioned to expand our organizational existing platforms and integrate viral hepatitis and injection drug use with all the public health priorities that each organization focuses on. So I do just want to pause. You know, I see a handful of folks that have just joined, so feel free to introduce yourself in the chat box. You can turn on your webcams and get settled in for the event today. So moving to what is HepNet, we actually have an awesome HepNet one-pager, and props to Cass. We're going to include that in the chat box so everyone can take a look at it, save it for future reference, or share out with others. I'm going to go through the first paragraph here. So HepNet is the Hepatitis Network for Education and Testing. It's a network of public health partners, community-based organizations, tribal health organizations, people with lived experience, and healthcare providers, focused on identifying and addressing the unmet needs of people who inject drugs to improve their access to viral hepatitis education, prevention, testing, linkage to care and treatment. So this, covers, you know, a large array of services that we could talk about, but it primarily is also providing technical assistance, trainings, resource development. So you'll learn more about our network stakeholders and structure as we continue in this presentation. But first, I do want to show you a quick peek at our HepNet microsite. So I'm going to screen share here so we can quickly go through this. Want to confirm everyone can see the screen? Okay. So this is our HepNet microsite, and the link is in the chat box if you want to follow along. So you can see here just a brief paragraph about what the project is. We have our mission and our vision statement that our partnership team crafted, and then upcoming events. So right now we have our HepNet town hall that you can see, you know, what it is. You can scroll down to register, but this will also be useful for future events that are coming up, whether this is a listening session, a focus group, you know, another topic specific webinar. And then we have a resource warehouse here. Right now we do have the one pager that's included in it, but this is for future resource development. So even once this presentation is archived, we'll have the recording and the slides. They'll be uploaded here for easy access. You have NASTAD's contact information, which is myself, but then also how to join the network and sign up using this recruitment form, which leads me now to turn it over to Cass to elaborate on the recruitment process.
Great, yeah, I think once we get the slides back up, you can kind of get a visual of it, but we have a recruitment form to officially sign up to become a member of the network, and that'll get you on the mailing list. You know, you'll find out about all of the network activities, events, and some other stuff that will include opportunities we're going to talk about in a bit. But you can get to this a couple of different ways. You can always find it at the bottom of nastad.org/HepNet, which is the microsite that Jasmine just took you through. And then we're also putting a direct link into the chat. So go ahead and pull that up, fill that out whenever is convenient for you. It's got information just about you and your contact info. And then I wanted to highlight that it's kind of written, you know, assuming organizational affiliation a little bit. So if you have an organization that you're a part of and kind of joining in conjunction with, go ahead and fill that out. But there is an option if you're just signing up as an individual, maybe you're a patient advocate, for example, you can say, I'm not affiliated with an organization, and it's totally cool to sign up that way too. If you have any questions about the recruitment form, have any trouble signing up, our contact information is in the little blurb that's going to be at the top of the page. So you should always feel free to just send me or send Jasmine an email if you have any questions about recruitment. And then I did want to highlight our amazing primary partners. So we've got organizations that have agreed to partner with us on this initiative and kind of bring a lot of varied experience and expertise. to the table, and I'm going to go through and just tell you a little bit about each of them. So we've got the Hepatitis B Foundation, or HBF, and the Hepatitis B Foundation has worked closely with NASTAD in the past. They're eager to be a primary partner on this project. And oftentimes we only hear about hepatitis C when we're talking about viral hepatitis work, but Hepatitis B Foundation consistently advocates and integrates hepatitis B into hepatitis programming, raising awareness on health equity and empowerment of those affected by hepatitis B. They are dedicated to improving access to care and treatment for individuals living with hepatitis B and supporting immunization and treatment initiatives, particularly among Asian Americans, Pacific Islanders, and other at-risk communities. Next, we've got the Latino Commission on AIDS, or LCOA, LCOA, and they're a nonprofit organization dedicated to health advocacy for Latinos, promoting HIV and hepatitis C education, developing model prevention programs for high-risk communities, and by building capacity in community organizations. And LCOA emphasizes the impact of hepatitis C and its impact on the Hispanic Latinx community in efforts to provide education and raise viral hepatitis awareness, including promotion of screening, prevention, and care. One of their main purposes is the direct services delivery to clients and their communities so they can learn more about viral hepatitis inequities and make better informed decisions about their health. We've also got the Northwest Portland Area Indian Health Board, NPAIHB, and they were established in 1972. NPAIHB is a nonprofit tribal advisory organization that serves the 43 federally recognized tribes of Oregon, Washington, and Idaho. And each member tribe meets quarterly to direct and oversee all activities of NPAIHB. And as part of their work, they support national level technical assistance, capacity building, research, and clinical and community programming on harm reduction, substance use, HIV, HCV, STIs, and holistic healthcare across all tribes in Indian country. Finally, we've got the Urban Survivors Union, which is a grassroots coalition dedicated to ensuring respect, dignity, and social justice for our community. We contest at USU the dominant culture's misguided attitudes and biases about drug use and drug users. All USU activities are directed and carried out by drug users, former and active, in order to ensure the integrity of their mission and that of the drug users movement. So thanks for letting me tell you about these wonderful organizations that we're super excited to partner with. So next I'll talk about the roles that are kind of like available or how you can conceptualize your role potentially in HepNET. So the network structure is such that, the larger network is made up of the network members, which is all of you. You sign up, you fill out that form, and the network members then, can participate in all of our ongoing webinars, our activities. But we will also have an opportunity for some more intensive work. And so what we have is learning communities. And, that's going to be smaller cohorts of communities that are made up of the network members, but folks who are selected and recruited to join to work more intensively toward a specific goal. So the main network, we're all kind of working toward our common goal of reducing inequity in viral hepatitis care for people who inject drugs. Then smaller cohorts of learning communities are going to work toward maybe more specific goals under that umbrella. And then, these communities are going to be led by the partner team, but it'll also be in consultation with paid leading with lived experience consultants who lead from their expertise from lived experience with drug use and or viral hepatitis. So next slide, we'll kind of go into this a little bit more. So the network members, again, it's all of the individuals and organizations that are making up HepNET. And this visual here shows the arrow kind of feeding into, from the network members, we're going to get our training consultants who train the LLE consultants, who then assist the learning communities that'll be recruited for at a later date. So if you go to the next slide, just a little bit more information on the training consultants, because these are folks who are going to develop a curriculum in concert with the partner team. And we have hired North Carolina Survivors Union, Nick Voiles and Tina Reynolds are going to be the leads on this project. And what they'll do is, develop and deliver this curriculum to a pool of leading with lived experience consultants who are individuals trained to provide technical assistance and capacity building assistance to the learning communities through the lens, again, of their lived expertise with viral hepatitis and/or drug use. Next slide. And just highlighting again that the learning communities are going to be this more intensive TA, CBA, technical assistance, capacity building assistance group. And each learning community is going to include representation from state health department, tribal and/or local health departments, federally qualified health or other setting, harm reduction and/or behavioral health service provider, hepatitis patient advocate. So it's going to be holistically made up of, I think, like all of the different stakeholders that we believe it takes to work together toward these specific goals that the learning communities are going to be organized around. And the recruitment and application processes are going to be announced at a later date. And next slide, I'll hand this off to Kat with NACCHO to talk about how you can be involved.
Great, thank you so much. So now that you all know a little bit more about HepNET, we really hope that you'll be joining us, and you can sign up today to become a network member. We've shared it, but we'll again drop the link to the recruitment form in the chat box momentarily. And then we'll also be using that list of network members to promote when we start recruiting for LLE consultants and the learning communities. So signing up for the network today is the best way to be notified when those opportunities are available as well. So we do want to take a moment now to do a brief poll to get a sense of how can we make virtual events more interactive and enjoyable for you. And so we'll be pulling that poll up in just a second. All right, so everyone should be able to see that now. If you don't, you can go ahead and raise your hand or note in the chat box, but otherwise you can start. All right, it looks like people are in fact starting to vote, so we should be good there. All right, we'll wait another 10 seconds or more to let remaining people vote. All right, and then I actually think that I have the ability to share the results back with the group. So as you can see, I believe you all can see on the screen, some of the most common responses to this question about how we can make virtual events more interactive and enjoyable for you include polling throughout the event. So good, we're already hitting that one. Nearly 2/3 of you said that. Just over half of you said more storytelling would be useful, as well as panel discussion Q&A, so opportunities to ask presenter questions, which is good because we also have that planned in just a few minutes. And then we also heard positively that about 1/3 of participants on this webinar on this town hall are interested in breakout sessions with smaller groups. And there may be another response or two shared in the chat box. So thank you all for responding to that poll. And we can stop sharing and go to the next slide. All right, so as you know, we discussed at the beginning, the vision for this town hall is that it's really interactive, engaging, and starts to foster that sense of community. You know, we want to make sure that all of you learn what HepNET is and are encouraged to become a member, but you know, also that you're all able to provide feedback for how our partnership team can tailor the network and tailor our offerings, including trainings and technical assistance and tools to help your work. So we do want to take a moment now to just pause and open the floor for any questions you all have so far, or feedback for that matter. And so you can do this a couple ways. You can enter into the chat box, which we'll be monitoring, or you can use the raise hand feature in Zoom, at which point we will be able to call on you so you can unmute yourself. So I see there's a comment in the chat box about the consultancy application information. So that will be shared as soon as it's ready. That will be shared out to the network members. So registering for the network today is the best way to get that information. I don't see any hands up, but we can go ahead and wait a few more seconds in case people have questions. So we have another question in the chat box. Am I understanding correctly that this is the beginning of this forum? You're getting interest? Yeah, I can start to answer that and then Cass, Jasmine, if you have anything to add. But yes, this is the official public launch, launching it so that, interested people can join. And then there will be, a number of events and offerings moving forward. So we also have a question about, is a goal of HepNET to eliminate hepatitis C by 2030? Cass or Jasmine, do you want to talk more about the goals for HepNET?
Yeah, I would say, our main goal is to reduce health inequities for people who use drugs, right? But I think we're in alignment with some of the world goals and large entities goals of eliminating Hep C with 2030. Jasmine, would you want to expand on that at all, or are you in agreement?
I think that's beautifully said. When we crafted our vision, it's to improve health outcomes for people who inject drugs by decreasing the burden of viral hepatitis and other preventable harms. So yes, definitely in alignment with the elimination of Hep C by 2030.
Great, thank you. And our next question is, since this is a federally funded effort, what's its lifespan? Is there a plan to continue after the cooperative agreement ends?
Yeah, thanks for that, Ronald. So this is a 5-year cooperative agreement. I think, when it comes to hepatitis and drug use, it's always a matter of where is the funding going. So I think we can cross our fingers and maybe hold our breath, but it's also contingent on how we, show what we've succeeded over the course of this COAG. So time will tell, but our hopes are that yes, there is a sustained response thereafter.
Great, thank you. Our next question, do you partner with manufacturers on education, and who would be the contact for such partnerships?
And I guess it's dependent on your definition of manufacturers. I don't know if you're envisioning big pharma, but it's not to say that we partner directly. No, it's not to say that they couldn't be HepNET members themselves and be part of this network. I do think that we're open to all collaboration, but in regards to manufacturers, maybe that's a one-off conversation that we can have.
Thank you. And our next question, what are the expectations for members? Time commitment, fees, etc.?
Yeah, so I think, like I said, you can just participate as a network member and, receive updates via email and, come to the webinars, come to any events that we have as makes sense for you. So I think, own your participation in it. We just want you to stay, in touch with us and knowing what's going on. But there are opportunities for more direct involvement, such as, applying for the learning communities and being a part of that more intensive work towards specific goals that, that your organization or that you might have as an advocate. And there's no cost to participate. No, sorry, I missed that part about the fees.
So we'll go ahead and wait just a couple seconds in case there's any final questions. All right, and then we'll move on to the next slide. Oh, and I just missed one more question. Could an example of a TA request for this group include something like sharing a locally created flyer with the group to hear feedback from those with lived experience? Yeah, I don't know, Jasmine or Cass, if there's anything you want to add, but yeah, I think that's a great example of the kind of TA request that would be totally appropriate for HepNET.
Yeah, and I think information like that is what we're gonna look to hear from you and like what would be helpful in this next aspect of this town hall. So I think that's a good segue, Kat.
Yeah. So now we're going to break into breakout groups for approximately 15 minutes to learn more from all of you about how this network can best achieve its goals. And so we're going to be discussing a number of topics that the facilitators will be prepared with, but these will be things like what competencies or capacities does your organization most need to address viral hepatitis among people who use drugs? What subgroups of people who use drugs and other populations should we focus on? As well as what strategies to increase uptake of hepatitis services should we focus on? So we'll have a number of questions to basically get a sense of what our priorities for HepNET moving forward. So you'll be randomly assigned into breakout rooms, and each breakout room will have a member of the partner team. So someone from NACCHO, NASTAD, or NVHR, who will be facilitating the conversation and reporting back to the full group at the end of the breakout room. Next slide. All right, so in just a moment, you should see a little box pop up on your screen that looks like what you can see there on the slide. And essentially, you'll just need to click join breakout room in order to be moved into your automatically randomly assigned breakout room.
And folks can stay in the main room?
Yes.
All right. Are we ready?
Yes, go ahead.
So now it's time to report back. We do have some of our partnership team members who are going to report back from those breakout groups, excuse me. So Anjana, if you wouldn't mind getting us started, what were some of the key takeaways from your breakout room?
Yeah, sure. So we had a really great discussion, and we only got through a couple questions because it was just a rich discussion. So in terms of question one, talking about capacities, core competencies, a couple people were talking about data, just issues around getting data, evaluation, surveillance, knowing what's out there, what tools to use, definitions. And then the idea of just wanting to know what other state and local health departments are doing, which is great, so that other people could kind of build off of that. And then also someone talked about testing kits, the availability of those, and trying to secure funding. So that would be one thing as well. And then somebody else talked about linguistically materials in languages other than English and Spanish. And then our second question, we talked about pregnant people who use drugs as a subgroup, as well as rural people. And then folks on Medicaid as another population. And then we were in discussion about how education is important, and we got cut off. So those were some of our takeaways.
Great, thanks for that, Anjana. I think we might hear some repeat themes from different groups. I see too in the chat box, language perinatal prevention is so important. Let's hear from some others, because this dialogue is helping us inform what the next year looks like in regards to future webinars, TA that folks will need for our network members. So if I may, Kat, can you report back from your breakout group, please?
Yeah, we definitely heard a lot of similar themes, especially when it came to populations. There's a recognition that there's a really important need to offer or connect people to hepatitis services from prenatal and perinatal care, and to make sure that these populations are being reached. So a real interest in reaching pregnant people with hepatitis testing. And then also, some conversation around thinking about young adults who are often left out of the conversation around viral hepatitis. In terms of some of the core competencies, in terms of the strategies that should be prioritized, some of what we heard included essentially, getting SSPs to partner with hepatitis services. So we know, often syringe services programs are on the forefront of the overdose epidemic, and there's so many priorities that they need to be addressing. And so creating buy-in to encourage them to partner with providers and health departments to prioritize hepatitis services was one topic that came up. Some others talked about how a lot of providers, clinical providers aren't necessarily experts on hepatitis work in and of itself, so there's a need to do provider education as well. And then certainly one of the biggest themes that came up were challenges around linkage to care for hepatitis services, especially for people who use drugs. And this came up generally as a clinical challenge, but also we discussed the challenges, how that challenge relates to data needs. So for example, the lab work that's needed to demonstrate a case of hepatitis C is acute. It can be challenging to get that lab work done. But that data demonstrating that it's acute is really helpful for advocating for harm reduction services. So an interesting conversation about how linkage to care is important for patients, but also important for data. So yeah, those were, I think, the biggest themes that came up. Definitely some overlap with Anjana's group.
Great, thanks for that, Cass. I'm taking a deep breath because I'm like, okay, we have a lot to do in the best way. So if we can hear from Adrian's group, let's see what your group had to say.
Yeah, sure thing. Thanks, Jasmine. There definitely has been, there was a lot of overlap with some of the previous report outs. So I'll focus on the things maybe that are a little bit different. In terms of capacities and core competencies, we had some discussion around needing support around just marketing your services. So letting people know that services exist, getting the word out in the community, especially in light of the fact that so much of it is reliant upon word of mouth. We also talked about building partnerships broadly and being able to scale up services, but more specifically, developing partnerships between local syringe services programs and health departments. We discussed the importance of providing hepatitis A and hepatitis B vaccinations in jails and prisons. And an overarching theme was, in terms of strategies for us to consider, is just the ability to share examples of best practices, regardless of what the topic might be. In terms of subgroups of people who use drugs, a couple of groups that we haven't talked about, people experiencing homelessness, people who were recently incarcerated, and people who use methamphetamine were all communities that were identified in our breakout room. So I think that about covers it in terms of, otherwise, I echo everything else that's been shared.
Thanks for that, Adrian, especially emphasizing the subgroups that maybe weren't mentioned in the other groups. If I may, Daniel, can you speak to your breakout group?
Sure thing. Thanks, Jasmine. Hi, everyone. Daniel Raymond with NVHR. We were in breakout group number 1. I'm sure everybody thinks that their breakout group was number 1, but I think ours actually was. And the key themes that came out were some specific interest in how to integrate hepatitis B screening into harm reduction and outreach settings. Settings that are currently successfully doing hepatitis C screening, but have not figured out how to work in hepatitis B screening. Some of the challenges involve things around blood work and labs and the funding and payment for them. We also heard, I think this builds a little bit on something that Kat said, some questions around how to figure out and navigate state requirements around assessing fibrosis stage as a precondition for hepatitis C treatment. And there was some information sharing during our group about what that looked like in different states. We also heard as a key theme, which I think we've heard before, navigating challenging or restrictive state policy environments for harm reduction, particularly around syringe services programs. So I think all consistent across the breakout groups, but continue to kind of build a deeper sense of where the field is and where we can provide support through HepNET.
Absolutely. Thank you for that. I think too, that's related to one of the questions that was asked right before we went into breakout groups. There's a question from Lana: as federally funded program, will HepNET provide any avenues for health departments in states with legislation limiting harm reduction work, such as illegal to distribute syringes, et cetera? And I think just broadly saying that this network will support SSPs, including in jurisdictions where there may be limiting legislation. So it's not to say we couldn't have, a focus or a learning community specifically for that. So future conversations to be had. I actually wanted to call on our training consultant, Nick Boyles. Unfortunately, Tina Reynolds is not able to join today, but Nick, if you would just like to say a quick hello and maybe introduce yourself, that would be wonderful.
Sure, I'm happy to. I know so many of you. It's nice to see a lot of you. My name is Nick Boyles, and I am the treasurer of the North Carolina Survivors Union and the Hep C liaison of Urban Survivors Union and the executive director at Indiana Recovery Alliance. I am absolutely thrilled to be working with NVHR, NASTAD, and NACCHO. This is near and dear to my heart. I suffered through an interferon and ribavirin, and then never even had I had to go to my community to get cured. So all of this is where I cut my teeth. I love all things patient advocacy from a lived experience perspective, and I'm real interested in getting these materials out there and getting these modules for other people to feel the same way I felt about doing this work. So I'm really happy to be here, and thank you all for allowing me to be here.
Thanks for that, Nick. We're excited to have you and Tina on board.
Oh yes, and Tina is on vacation and was trying to connect earlier and couldn't. So she's texted me about 5 times. So she's really sorry she couldn't make it here.
Oh, no worries. We'll definitely have interactions with her to come. So we're excited for that. With that, some resources are being shared out in the chat box, but I do want to go to the next slide so we can wrap this up. I mean, first and foremost, want to thank everybody for joining today. The breakout sessions, those were incredibly informative. I think a lot of the resources that were shared out too from other folks is very useful. So we are going to be intentional about incorporating your feedback and things that we've heard from the breakout groups as we move forward. So future trainings, events, technical assistance, resource development. I do want to throw this out there though. So the hour that you've experienced of our HepNET town hall, if you can think of others who might want to join or be interested in joining, I mean, word of mouth is powerful. So please feel free to share the recruitment form. We're going to include that back in the chat box as well. Just a reminder too, the recording and slides, they will be circulated next week. They'll be uploaded to our HepNET microsite. And lastly, we have about 3 minutes to spare, but I want to allow time for people to complete the short evaluation. You know, in doing so, it really helps us see what's beneficial to you, but also how we can improve and make the best use of your time as we do future events similar to this. So with that, you can always reach out, but thanks everyone for joining. Thanks to the partnership team for the debut of HepNET. I'm going to keep the line open, but we will all be in touch. So thank you so much. If only I could cue some music while folks are taking the evaluation. But
I was literally thinking that, Jasmine. I was like, this would be the perfect place for some nice, smooth yawn out music, you know?
Right? I mean, you can get out your microphone, Nick. I don't know.
Yeah, but last time you guys all like hung up the second I started singing, you know, like that hurt me, you know, it was hard to come back from that.
Maybe future events we'll get started with the music.
Definitely.
All right. Thanks again, everybody. We are going to keep it open for a few more minutes. The evaluation link will include it in the chat box. Thanks, Morgan. Thanks, Shamia. Yeah, no, we'll definitely be in touch. And like we said, you know, you are helping inform our process and build out of this project. So we appreciate you being here.